I'd like to introduce our host, Dr. Rashid Mosavin. Dr. Mosavin is Dean, College of Pharmacy and Health Sciences with the Texas Southern University in Houston. He is also the chair of the Research Advisory Council. Welcome and thank you.
Thank you so much, Barbara. I hope you can all hear me and see me. Thank you to all of you, our preceptors, brand new residents, my colleagues, members of the council. Thank you all for your time. Thank you for being here. And of course, I want to thank our two esteemed colleagues, Dr. Alyssa Margraf and Dr. Elizabeth Salisbury. Thank you so much for your time to be here this afternoon and share with all of us, especially with our brand new residents, your experience and your wisdom as the grantees of ASHP Award in the past. So if you're ready, I would like to start with you, Dr. Margraf, and ask you to tell us a little bit about yourself, where you did your residency training, and where are you now in your career?
Sure. Well, thanks for having me and good afternoon to everyone. My name's Dr. Alyssa Margraf, and I did my PGY1 at a community-based Walgreens residency program that was joint with the University of Rhode Island. And I stayed in Rhode Island for my second year. I did my ambulatory care PGY2 at Rhode Island Hospital. And I'm still in Rhode Island, and I stayed at Rhode Island Hospital.
Fantastic. Same question to you, Dr. Salisbury. Tell us about yourself, where you did residency, where you're today.
Absolutely. So my name is Dr. Elizabeth Salisbury. I am currently also actually working at Rhode Island Hospital. Just a little bit of background on me. I completed a PGY1 residency training at as a community-based residency program at the University of North Carolina, Chapel Hill, right at their health services facilities there. And also similar to Dr. Margraf, I did the same residency training for a PGY2, and Dr. Margraf was actually one of my preceptors during it, but it was a PGY2 ambulatory care-based residency program at Rhode Island Hospital and affiliated with the University of Rhode Island. Currently, I am a clinical pharmacy specialist in an outpatient psychiatric clinic, and that's affiliated, again, with Rhode Island Hospital. So it's kind of Alyssa or Dr. Margraf is one of my fellow pharmacists there.
Fantastic. Dr. Salisbury, I think I want to stay with you and ask you to tell us about your project's main objectives. How did that come about? Some of the findings, a little detail about your project.
Absolutely. So it's interesting. Dr. Margraf was my research preceptor during my PGY2 residency. So we actually have a flipped research model at Rhode Island Hospital for all of our residents, PGY1 and PGY2, as well as specialized. And what that is basically, for those who might not be familiar with the flipped research model, is a project is kind of already created and established and gone through the initial phases of creation before the residents come on board. So I was very fortunate to come on board and have a project that aligned with my interest that was submitted by Dr. Margraf. So the project title was Impact of Pharmacist-Mediated Refill Authorization on Proton Pump Inhibitor Deprescribing Success Rates. Okay, and you'll notice as you're going through residency for the residents here, the titles of these research projects are very expansive. So what the heck did I actually study? So alongside Dr. Margraf, we looked at our primary objective of assessing the success rates of PPI deprescribing from our centralized medication access program through a very standardized approach that could hopefully be translated to other facilities as well.
Tell us a little bit about the how did the funding work out, and you presented it, published it.
So great question. So how did the funding work out? That's essentially what led me here today to be a speaker for this forum. So I had applied, I was encouraged to apply by Dr. Margraf and applied and was successfully granted the ASHP Research Foundation grant, which really helped me in order to grasp the full experience of PGY2 and residency research in general, without necessarily having as many concerns and the financial barriers that other residents and programs might unfortunately have in place. So it really allowed me to dive right into the research project and get as much as I could out of this year of research. So I'm very, very grateful for that grant that allowed me to really have a year of research. I wasn't expecting the year of research that much, but it certainly was well received.
Fantastic. Dr. Margraf, can I also ask you the same question? Tell us a little bit about your project when you started out, objectives, findings, funding.
Sure. Yeah, so a couple years before Liz is when I did my residency with the Rhode Island Hospital in ambulatory care, and we didn't have a flipped research model at that time. So the intention was that we'd go in with a project that we're passionate about and see it out from start to finish. So I was very interested in deprescribing, and specifically with, could we come up with a opioid deprescribing protocol, which is controversial topic, and I wanted to gather a group of stakeholders that are from various disciplines to put together a feasibility study to see how could we best implement a deprescribing protocol in older adult population. So I was fortunate to receive the ASHP resident grant funding that year, which was the 2020 year. So we'll get into challenges a little bit later, and you may kind of see where I'm going with that. But I was able to put together stakeholders and meet 3 times with a group of specialists in various disciplines, subspecialties in addiction medicine, palliative care, and social work, nursing, pharmacists, and gather these group of people. We recorded all of the meetings, and with the grant funding, I was able to transcribe all of the meetings and then hire data analysts who had some experience in qualitative research to code and put together themes, and throughout all the discussions to then publish my manuscript, which was published in AJHP last year.
Yes, I've actually read both of your articles. So tell us, if I can stay with you, Dr. Margraf, tell us about, there is the idea, and then there's the transition to actually starting. How does that look like? So I want to start with you, and then I'm going to go to Dr. Salisbury. Going from an idea to actually starting the project, how's that transition in your experience?
Yeah, so the idea, I would say, had been brewing for a little while. From my prior experience and interest in pharmacy school, and then building in my PGY 1 year, I found something that I was passionate about or wanted to learn more about, was curious about, and then entering my PGY 2 year, what is novel about this? Trying to find some questions, some gaps that are in the literature or could be expanded upon. Because, everyone wants to read about what's new, what can we do to advance pharmacy in our profession. It was during my P4 year, actually, that I first got a little bit more involved in research, working with a mentor that was doing yoga as an intervention for chronic pain and different complementary alternative approaches to medicine. I thought that was fascinating. And so during my PGY 1 year, I took it a step further, and I got my 200-hour yoga teaching certificate. So my P1 year, I did a prospective study on older adults with chronic pain and implementing chair yoga as an intervention. And then from there, moving on to PGY 2 year, I realized a lot of these patients that I was seeing in my community-based home care program were on these chronic opioids, and is there anything we can do to help them out? So that was the idea, and I started doing some of the digging on my own, and there really wasn't a lot out there on how to taper opioids or how to do it safely, appropriately, and not just taper them, but also have a substitution intervention. And so then putting that into action was, well, we can't just do it, right? Like we have to be mindful about how we're doing things. So before we start a protocol, we should probably test the feasibility of a protocol. So that's where my idea of studying the feasibility of it came about.
Fantastic. Thank you so much. And to you, Dr. Salisbury, tell us about, again, the transition for you from the idea to the start of the project. How was that experience for you?
Absolutely. And a little bit different for me compared to Dr. Margraf, just because of that flipped research model, which I think a lot of programs now might be leaning more towards, just so that you can kind of jump that hurdle of IRB and all those things before the residents kind of come on board. So as I previously mentioned, Dr. Margraf's idea for the research project, she alluded to her passion for deprescribing. So really it was my role as the resident during the residency year to see how I could take her idea and really sort of develop further and refine the methods, the data collection, especially integrating within the healthcare system as a whole. As we mentioned, we're part of Lifespan Rhode Island Hospital. But the focus for us and Alyssa as a preceptor was always really trying to push me to focus more on pharmacy advancements and how can we work together and create research and data that's going to show how pharmacists play a huge role on the interdisciplinary team, and that role really has no bounds, and that we can also, yes, we like medication, but also a huge part of what we're doing is taking away and deprescribing inappropriate or potentially inappropriate medications. So with that flipped research model, just to summarize, the idea was already put in place and the process had started, and then I came on board and kind of took it over with Dr. Margraf's guidance and did the finishing touches on IRB, and we ended up collecting data together and that sort of thing. So the idea was already in place, and then we hit the ground running during residency year.
Fantastic. And Dr. Salisbury, staying with you, as we all know, you start the project, but not everything goes as planned. So talk to us a little bit about what are some of those hurdles, the bumps on the road, and what did you have to do to overcome those?
Absolutely. So during residency year, whether it's PGY1, PGY2, there's always going to be bumps in the road, research or non-research related, right? That's the whole point of residency, is to help us grow and develop as pharmacists. So unfortunately, the research project that Alyssa and I submitted, and initially it was denied IRB approval. And this kind of just goes into the reason for denial basically surrounded the misunderstanding of scope of pharmacy practice. So it was a really interesting time. Dr. Margraf and I, we were invited to an IRB meeting, and we thought, here we go. They love our project. They're going to congratulate us on it. And we unfortunately sat through that meeting and weren't as well prepared as we could have been, because we had thought that the project was great. It was ready to go. It already got the grant application and the approval. So we're ready to go. And that was when they told us that our IRB was not approved. And we essentially had to restart the process. So what that looked like for us is, yes, this was a hurdle, but also in hindsight, and I say in hindsight because during this residency year, we had so many other things going on that not getting IRB approval when my co-residents was really disheartening. But in the long run, it did teach a lot. And I know everyone says, oh, it's a learning experience, right? And sometimes during residency, I think I would turn around and roll my eyes at the learning experience, but it truly was a fantastic learning experience. So combating IRB, advancing pharmacy practice, and advocating for our scope of practice that we have here in Rhode Island and why it's appropriate for pharmacists to have deprescribing recommendations. We ended up changing the study from prospective to retrospective, which ended up getting approval. So that was kind of the
Fantastic.
biggest hurdle that we faced.
So it was like a Shark Tank and everybody said no type of thing. Then you had to go back and
Absolutely.
great. Same question for you, Dr. Margraf. What were some of those hurdles, obstacles when you did your project?
Yeah, so I received funding in 2020, and then shortly after the COVID pandemic hit. So the big part of my study and the important aspect was getting these stakeholders together in a room to discuss opioid deprescribing. Obviously, priorities changed in February. So we had 2 more meetings scheduled that were slated, and then everything kind of got pushed back and rolled over. And then we switched to remote meetings. So we ended up like overcoming that hurdle and getting everyone together. At the end of the day, I was able to successfully get the group together, have a really nice discussion that ultimately, I think we came up with some fantastic themes that you can see in the manuscript. But that was a big hurdle in overcoming just changes during the year that we didn't anticipate.
Excellent. And I think as you both sort of mentioned it in your response, and this is what I tell students, as Barbara said, I'm a dean of a college, I educate future pharmacists. Hurdles are actually a necessary step to your success. They have to be there. It's working hard is necessary, but so are hurdles. Let me ask both of you, whoever wants to start first, what words of advice do you have for the residents we have in the audience as they begin their projects? What's your word of wisdom for them?
I'm happy to start. I think it's important to choose a project that you're passionate about, or at least curious about, because it does take perseverance to get to the end of data collection, do the data analysis, present your results in some means. And that might not all happen at the end of your residency year. You might have already graduated by the time you're ready to publish a manuscript. And it takes some resilience and task management and priority shifting to really get it to that point. It wasn't until 2023 when my manuscript did get published, which was 3 years after I graduated residency. So you definitely want to stick with something that you're interested in. And if you're going into an environment where there is a flipped research model, where you're choosing from a list of projects that have already been developed, take some time to look through all of them thoroughly and ask if you can meet with some of the preceptors that have proposed those ideas first to make sure it's something you're really interested in.
Fantastic. Thank you for that. Dr. Salisbury?
Yeah, so I would just say do it, right? And what does that exactly mean? It means just do the thing. I never expected that I would be here today talking on an ASHP forum had I not been pushed by my preceptors to apply for the grant several years ago. So it could be scary, intimidating, but we remember kind of why we took that oath many years back. And I really am looking forward the research endeavors, they really have helped kind of push me forward as an individual in pharmacy, but also hopefully can help to push the profession forward a little bit too. But with that in mind, you are not alone, right? So you can do it and you can gain all these skills and develop new strategies for research, but lean on those around you. There are previous residents who have applied for grants and have completed research projects. Hopefully you would have somebody at your institution that may have experience in research that you can lean on. But I was emailing people I've never met in person, just introducing myself to say, hi, I heard you do data analyst. Like, can you help me, please? And more than likely, people are willing to assist. So really lean on others and try to acquire their pearls of wisdom as you go.
Great, fantastic. What I want to ask both of you to comment on, what are your plans for disseminating your results? Is that ongoing? How's that working out?
So I can start with that, Alyssa.
Please go ahead.
So for dissemination of results, so I actually, due to IRB complications, I asked for a research grant extension, which was granted, which was very, very important for me in order to kind of take those initial first steps of disseminating results. So as Dr. Margraf alluded to, it's not usually a super quick process. So very recently, actually this past summer, it's still summer. A few months ago, I went to ASHP Pharmacy Futures and presented my research there. It was well received, and I got a lot of really great feedback on it as well that hopefully I can use to formulate some sort of article. And so next steps for me would be looking for kind of timeline wise, making sure that it is aligning with my work now and my employment, and making sure that I'm keeping on task with certain things, which can be the most challenging part, but in order to kind of disseminate my results. So
Excellent. And you, Dr. Margaret?
Yeah, I would say that I'm kind of finished with that project at this point. I did publish in AGHP, and my role has shifted slightly. I'm a clinical specialist in gastroenterology now and mainly work with our IBD patients. So my research interests have changed a bit in what I'm doing with that. But I'm very happy that the work that I put into that year is out there. It's available now, and I would hope someone from a large institution picks it up and rolls with it.
Fantastic. I have one more question for both of you, whoever wants to start first. It's more of a conceptual question. And you're both published researchers now. So the question I would ask, so think of it as I'm a first-year resident, and I'll ask you, why even do research? Why don't I just, come to residency, learn more what I need to learn in a clinical setting? Why do research at all? Why is that important?
I can start. I think more than just doing research, what's important is getting new information out there. Results do matter, and if you're not getting out there what you did in that entire year, no one's gonna be able to gain from it. So I think it is important to persevere and push through and to share what you've learned. It helps to advance the pharmacy profession, and patient outcomes ultimately is what we're hoping for.
Dr. Salisbury, what's your view on that?
yeah, so thank you for asking another really good question. And I think it's important for residents to hear this from the perspectives of a previous resident and research. So it's very similar to what Dr. Margraf said, is we're creators of new knowledge, right? And it can be really intimidating when you're starting residency and there are so many different things that you're supposed to be doing, so many different tasks and clinic responsibilities. And then to top it all off, you have research, right? And that was kind of my attitude when I started my PGY1, and I ended up really just enjoying the research process. It's kind of a puzzle, and you put every little piece together from your main objectives to the methods. And I found it really fun, and just it's a really great way to make new information and to support pharmacy. However, I thought residency was over. I'm done with research. It's not my forte per se. And now I am starting to create a pharmacist-led psychiatry clinic. And they're looking to pilot something there, and eventually that will hopefully be research. So it comes full circle, and there's so much value in doing a research project.
Fantastic. Dr. Margraf, Dr. Salisbury, I'm grateful. Thank you so much for sharing your wisdom with me. Colleagues, residents, really appreciate your time today. Very, very grateful to what you discussed with us. Very informative. Barbara, I will send it back to you.
I echo Dr. Mosaven's comments. Thank you so much for joining us. The activities like this wouldn't be possible without the generosity of our volunteers and our donors. So thank you. At this point, we're going to move in.